Okay, so aortic dissections. A lot of people sometimes my patients ask me about what exactly is an aortic dissection. Well, imagine your blood vessel is a tube, and when you look at it down the barrel of the tube, what you find is that the pressure can be so high that the wall of the blood vessel can actually split into two different lumens. Small, if blood is moving down this lumen, small hole somewhere within the lumen of the blood vessel. And what that causes is that blood is here on the inside. Blood is rushing down here, but going through the tear. I don't know if you can see that quite well. Through the tear right here. And going and creating a new false channel that is not supposed to be carrying blood within the wall of the aorta. And essentially, when that happens, you have high pressure going to all the main organs and all the side branches that are to feed your kidney, etc. But this new false lumen can become under such pressure that over time it can actually clog up and the main true lumen, and there's no from this false lumen. So the false lumen and how the false lumen appears can actually determine to some degree how well people will do after their aorta dissects. And in fact, if you have an aortic dissection and the false lumen is even on the inner curve of the aorta, some studies have shown that if this is where the tear is, and this is the false lumen here, and this is the true lumen with blood vessels coming off kidney, and then intestine vessels to the legs, you could block off this kidney vessel very easily if this false lumen here continues to expand this direction, and no blood can actually feed the kidney vessel. You have to remember all of this is a 3D structure. So when you look at it that way, and this lumen is here. Other things like if you have an aortic dissection and you have multiple false lumens, let's say you have a dissection over here on this side and a dissection over here on this side, that's a higher predictor that patients will ultimately probably die from the aortic dissection compared to someone who just has one single dissection. There are other things that have been shown to affect, the risk of expansion of the aorta, meaning that one of the big problems with these dissections is that once the blood is going into the false lumen, over time, you now have a split aortic wall, and over time, this whole aorta can dilate up and get bigger and bigger and bigger and bigger and bigger, 4 centimeters, 5.5 centimeters, at which point you're now with a 6-centimeter aorta here, and this is an aneurysm, what we'd call an aneurysm in this portion, right? It's more than 2 times the normal diameter of the vessel. And because of that, when you get to 6 centimeters, your risk of rupture, meaning your blood vessel is actually going to burst, it's actually quite significant. So some studies have shown that the people who have dissections, who have syndromes like Marfan's, or if there is kind of elliptical or saccular bulging of the false lumen, those are signs that could portend a worse prognosis. If the entry tear, let's say this entry tear here is bigger than 1 centimeter in diameter, that's a bad sign. So essentially, there are a number of other ones, like even race, Caucasians have a higher risk, and if the patient's younger, these are all signs that could kind of bode worse compared to other populations. But essentially, the key thing to know is that if you have this aortic dissection, you should see a vascular surgeon and start to get, or a cardiac surgeon if you have an ascending or arch transverse arch, this portion. So either a vascular surgeon, and probably actually combined that vascular and cardiac surgery, should see you and help to guide how your management is going to be carried out long term. And your goal is going to be to control your blood pressure and prevent any organs like your intestines, your kidneys from losing blood flow, and prevent this tear from getting bigger and bigger by keeping your blood pressure down and keeping the pulsatility of this aorta over time as low as possible, so that this doesn't split anymore, your blood vessels to your legs don't get compromised, etc. The repairs could be anything from an open surgery where you just make a big incision across the person's chest and sew it up, cutting through the ribs and replacing this with a sewing in a new graft. Or it could be something minimally invasive and then carrying down further grafts down. All of these procedures bring a risk of stroke. All of these procedures bring a risk of spinal cord ischemia because the spinal cord blood vessels come off the artery. And I think it's just important to know a little bit about this. And before you go and see your vascular surgeon, you should read. Before you go and see your vascular surgeon, you should read about this and kind of understand, watch as many YouTube videos as you can before you show up, so that you're really educated and you actually understand how to care for yourself, as well as really just what to ask your surgeon so that you're an informed patient. This is the age of technology, and at least the minimum that I think patients can do is to try to understand as much as they can, even though sometimes we don't really want to know the truth of what the disease is. I think it's probably wiser to know and deal with the risk up front than to not be sure or not be prepared when you go for a surgery, or even when you decide not to go for a surgery. Anyway, that's all I have for today. Aortic dissections, a little primer for you. And of course, remember, Blackwood Vascular is always available. We're innovating, we're educating, and we're empowering patients as well as providers to take back their lives and take back healthcare.